physician, welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in Shoreby, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
It's great to have you with us on this dimension of House Call. As the announcer said, Dr. Jensen and I are doctors of chiropractic. Certainly we do things like many other chiropractors do with muscle and joint problems, spinal problems, neurological problems, but we also practice orthomolecular medicine, meaning that we have a more of a whole person orientation to looking at our patients, and everything that we attempt to do is based on science. It's not based on unscientifically or unproven opinions and ideas of much of which the natural health industry is based on today. A lot of things that are said that are really scientifically unprovable. Today we're going to talk about healthy intestines. Why would we do that? We would do that because people say we are what we eat. It's not really true. We are not what we eat. We are what we digest and what we absorb. Therefore, the major significant area of health in the body is intestinal health. Therefore, if my intestines are not functioning, my stomach, my small intestine, large intestine, and other organs are not functioning the way that they should, then I am not going to enjoy health and wellness. It's just that simple. So what Dr. Jensen is going to do is he's going to talk about our normal gastrointestinal flora, and that's a good place to start, right?
Right. Thank you, Dr. Lala. Well, we're going to look at what occurs, what starts this. And it's really that the normal microflora of the GI tract, or gastrointestinal tract, are weakened or destroyed, allowing other flora to proliferate, such as the yeast and fungi and antigens and toxins and harmful bacteria that proliferate throughout the intestinal tract. And then what they do is they begin to irritate the lining of the intestinal tract, where they can gain entrance into the blood because they make it through the intestinal tract into the blood that's below that, and that predisposes people towards having systemic or health problems that go out throughout their entire body, and therefore can cause quite a lot of problems that we wouldn't just think was gastrointestinal in relation. Therefore, when we're looking at intestinal microflora, the intestinal microflora should be about 85% lactobacteria. Okay, we're talking about your acidophilus, we're talking about your bifidobacteria. No more than 15% of it should be coliform bacteria. So we're looking at the type of blend of bacteria that's normally found within the gastrointestinal tract. And presently, society is just the opposite of that. And so we're finding that there's much more gastrointestinal problems than there should be. So, Dr. Lala, what causes this to proliferate? What causes this whole ratio to be different?
It's really a good question, and we receive many questions that come over the telephone and letters and emails, and we invite you to do that. Or you can go out to our website and you can have programs from A to Z on natural health and healing, and the material that we produce is scientifically provable. We don't practice voodoo nutrition as so many are doing today. So therefore, what causes these abnormal intestinal bacteria or viruses or yeast or fungi to proliferate? The principal things are the person who has been given or taking antibiotics, people who take birth control pills, diets that are high in beef and refined sugar, diets that are low in water-soluble fiber. Now, what are some of the common signals or signs or symptoms of gastrointestinal dysbiosis? That's the word for it. Gastrointestinal malfunction. These are early warning signs. They include heartburn, gastritis, colitis, and gas and bloating is another. Diarrhea, as well as constipation. So a person may have chronic diarrhea or chronic constipation. Now, what are some of the common signals and symptoms, Dr. Jensen, that you could add to that, please, of the gastrointestinal tract itself?
Well, yeah, first we'll cover the gastrointestinal tract and then go on from there.
Genital urinary.
Or let's do into the genital urinary. Let's just go from there. First of all, there's yeast infections, and usually it's yeast vaginitis that is what we most see. There's menstrual irregularities that can come from that. Abdominal cramping and bloating that can come from there. So with that abdominal cramping, you're looking at cystitis, which is swelling of cysts that would form on the ovaries. Endometriosis, which would also be another problem that comes from the female reproductive organs, so again, genital urinary. Urethritis, which is a inflammation of the urethra, which is the tube that goes from the bladder out to outside of the body. And nephritis, which nephrons are the functional part of the kidney, so you're actually looking at an inflammation of the kidney itself. So that can be quite a big problem. And also within this, you can start to have common allergy-related symptoms, and those allergy-related symptoms of gastrointestinal imbalance of the flora can be asthma, more of hay fever, sinusitis, or should we say congestion within the sinuses, chronic sinusitis. Earaches can be from that. You can also have a case of hives, food sensitivities, and greater chemical sensitivities, such as to cleaning fluids and oil and car products, those kinds of things that are around. There are some people that can take exhaust on the street quite well, and other people, a car goes by and it just really knocks them for a loop. So that was the genital urinary area. What about the central nervous system, Dr. Lala?
So we've looked at the common signs and symptoms of gastrointestinal malfunction that are related to, and then Dr. Jensen has just looked at the genital urinary related symptoms of gastrointestinal malfunction, and now we're going to look at the central nervous system. So people who have gastrointestinal issues that are called dysbiosis, generally, if they begin to become systemic, meaning that these bugs, these viruses, these yeasts, these fungi get out of their small intestine, they get absorbed up into the blood, and we call it then a systemic disease. And when they begin to afflict the central nervous system, the person is predisposed to headaches, depression, lethargy, cognitive issues, as well as aging. In other words, we all have a normal aging process, but if our gastrointestinal system is not functioning in harmony, then it's going to advance aging. So we look at people that are like 40 years old and they look like they're 60, and you're seeing more and more of that today. Many of these people are taking vitamins and they're going to the health club and working out. They just don't realize they've never identified their own individual biochemical nature through scientific blood testing.
And this would include the aging of the central nervous system?
That's right. And
so with that, they would be more predisposed
to like dementia,
okay,
Parkinson's, and Alzheimer's are very, very common related to central nervous system, and many times those are in fact related to issues that they're not aware of, abnormal functioning within the gastrointestinal tract. Now, there are also some common related symptoms such as chronic fatigue. So many people who are suffering with chronic fatigue syndrome, it's a gastrointestinal cause. This also includes fibromyalgia, people suffering with arthritis, and loss of libido. Now, as doctors of chiropractic, certainly we see a lot of people with chronic back and joint problems, And instead of just looking at the spine only and giving adjustments and exercise and typical things that most chiropractors do, we're going to look at their nutritional perspective. And instead of just throwing some vitamins or minerals at them like a shotgun going boom, let's see if that helps. Here's some literature that says it will help. Well, many times when you do a blood test on them, you'll find, or a urine test on them, you'll find markers in those reports that indicate that there is gastrointestinal dysbiosis or malfunctioning that is really the cause of their chronic back and joint problems. And I personally and professionally believe that anybody who is suffering with chronic back and joint problems, and that includes any of these other symptoms we talked about of the gastrointestinal system, the genital and the urinary system as well. We just covered the central nervous system. If that chiropractor or that nutritionist isn't looking at some scientifically based blood and urinalysis tests and prescribing a diet or nutritional supplementation, I think it's a major mistake. I really do. And that also includes obesity and the opposite of obesity, anorexia. Many times, chronic overweight problems as well as anorexia and bulimia are really related to gastrointestinal disharmony. And you say, well, I'll go and take some acidophilus. It's an unbelievable number of people we talk to say, well, I'm taking acidophilus or I'm taking digestive enzymes, and that's fine. It may be well and good, but it may not be really the issue that they need. And the only way to find that out, of course, is through proper diagnostic testing. And I guess that brings us to something to discuss how to diagnose these things.
Right. Well, first of all, it's very important from the things that we were just talking about to take a history to find out whether they've had a history of bloating. By the way, when you come into the office and we ask, hey, how's your sex life? It's not that we're trying to pry. It's trying to see whether you have a loss of libido that's going on. How's your diet? Do you have any eating disorders? Those kinds of things. Do you have a problem with weight gain or not being able to gain weight? How's your cognitive dispositions going? Many times, like you were talking about the history of anorexia and bulimia, so many times these imbalances give off toxins into the body, and our body likes to stay the same. And that includes that if we are in a toxic state and we start to clear from that toxic state, the body says, wait a minute, I need to remain toxic to remain the same. So therefore, we're going to shift your diet, that you're going to want to eat more sweets and more proteins that ferment within your gastrointestinal tract in order to make some of these neighbors, unwanted neighbors, mind you, bloom and give off the neurotoxins and things to make us toxic again. Mm-hmm. And so many times it's really a lack of knowledge that you don't know that you're doing something wrong. You're just thinking, hey, I'm eating just what I like. Mm-hmm. And it's actually these things that are basically changing you, that it gives you more of a predisposition towards eating some of the foods that are giving you some of this weight problem.
And people think that they're saving money by not having diagnostic tests. Well, they're not really saving any money. What they're doing is setting themselves up to loss of health.
Look, you look at the business of diet and fitness, and it's in the billions. And it's not that people are always looking for an answer, but many times they're looking at an answer that is incomplete for them, that is not looking for them as an individual. And that if they have some of these answers, it says, you know what, this is one of the reasons why I don't eat correctly. Mm-hmm. And it's almost a hormonal hunger mm-hmm. that I get. I just can't leave this particular mm-hmm. thing alone. Mm-hmm. If they knew that was a problem for them from a very health standard, and that it affects so many different areas of their life, that's not just due to weight, that it could actually change them.
If a person doesn't know what their internal biochemistry is, they really can't manage it.
Right.
But if they do know through science-based diagnostic testing,
Right.
then they can manage their health.
And so far, all we've done is looked at the history, okay? And we've just covered that throughout the show. Some of the other testings that we might want to have is organic acids analysis, which tells us, among a plethora of other things, it tells us what's populating our gastrointestinal tract, whether it's bacteria, protozoal, yeast, or fungal in origin from their byproducts that are given off in our body that we've had to detoxify from. Another thing is to check for food sensitivities, those things that we're sensitive to. So we'll run a IgG and IgE food sensitivity tests to see what the fixed and cyclic food allergies are that we have. So that we're not feeding into this inflammation of our gastrointestinal tract and causing some of these things to proliferate. The next thing would be a chem screen and a CBC, which checks the different areas of our body to see where we're deficient in those elements that we need to in order to increase our health.
Basically, it's kind of like when I turn the key on in my truck, all of these lights flash on the dashboard. And then as the engine RPMs pick up, they disappear. So you're basically getting an automatic readout when you start your car, your truck, depending on what kind of electrical readouts they have for you.
Right.
Well, it's the same thing that when you do the blood test, or for example, the organic acid analysis, it gives you this readout very, very simply and very, very inexpensively. Simply, I mean, it's just so simple. But it has these profound results. Anything else to add to that then?
Well, if we look back at that organic acids test and find that it's finding out what organisms are proliferating through our system. And we really have a lot of organisms. We have like 3 trillion cells in our body that's us. We have more bacteria, yeast, protozoal, and things like that within us than we do have cells that are us. So really we're a community. And what the organic acid does is it helps us evaluate which of those things are things that help us and which things are things that don't help us. And what we want to do is change that so that it promotes health. So what we're looking at is the evaluation of a candida antigen, for one, evaluation of what we should take for probiotics. What are the appropriate probiotics to take?
What's so interesting about that is people will come in, or they'll call us, and they come in and they'll say, well, the other chiropractor or the nutritionist or my massage therapist, I mean, they're really qualified with education, aren't they, to be doing diagnosis. But they're playing, so many of them are playing doctor without a license. And so they'll say, well, I've been treating myself, or they've been treating me for candidiasis or yeast infection. We'll say, oh, well, how was that diagnosed? Well, they did some muscle testing on me.
Sure.
You know, applied kinesiology. Sure. Or my symptoms, or they had me fill out a chart.
Yep.
Or they read my eyeball, or they read my tongue, or they read my palm. That's how they did it. Or it was based on her experience. I must have candidiasis based on my symptoms. Well, I'll say, well, did they do a candida antigen titer? What's that? Well, your medical records that you brought in here show that they never did that. So we do, the candida test is done, like you say, in the part of the organic acid analysis. There's no indication of candidiasis or yeast infection.
Right.
Or people will come in and they say, I have this, and we'll say, are you treating yourself for it? No, not yet, I'm not yet. Well, it's not there. Or they come in and they've been treating themselves and it's still there. Well, it says the treatment is either wrong or, well, it's not either, it's just wrong.
Sure.
You know, but why, if I came to you and said, well, you have headaches, huh? Yep. Well, you must have a brain tumor.
Yeah.
Isn't that a clear analogy? You must have a brain tumor. Here's some food supplements now for treating brain tumor. Or, oh, you have cancer? Oh, well, here's some diet for cancer. You have arthritis? Here's some food supplements for arthritis. It doesn't make sense.
Yeah, they can assume the wrong diagnosis.
That's exactly
Another thing that the tests help us to look at is to look at more than what it is. A great illustration of that is something that I went through while I was going to school, being trained to be a chiropractor. And what it was a class in upper extremity with shoulders, elbows, and so forth. And they brought in a guy that, as a class, we were to interview and take the history and start to do orthopedics on. And the guy came in and he started giving us all this stuff about neck problems. And he got back from the class a lot of blank stares. And the doctor who was teaching the class says, "Oh, I see. You thought that a person who comes in to see you was only going to have a shoulder problem. We have to be able to look at all the other problems that may overlie the problem that's there." And so we had to learn to think outside the box as well.
Or for example, you have a shoulder problem, let me crack it and massage it or whatever, instead of taking an x-ray to see really what the cause of it is.
Sure.
Or you've got a neck or back problem, let me crack it without x-rays, we'll see if it helps you. Well, in the long run, those people may get some symptom relief, but there's a high likelihood there that they're really missing the underlying cause of those symptoms.
Absolutely.
That only the x-ray or a blood test can show.
Not only that, but it allows you to see any other thing that might be there. And that's one of the things why the Mayo Clinic had such a good reputation, is that they did the tests to find everything that was wrong.
Right.
Okay.
And that they did not practice shotgun drug therapy.
Right.
Or shotgun surgery, and they still don't.
And here's,
thank God.
Here's the thing with antibiotics. One of the problems that we had with antibiotics is that they give you a broad spectrum antibiotic. Well, the idea was, and why they still do strep cultures, is to see whether it's strep and see which antibiotic works most effectively on it, and therefore give you that one rather than the broad spectrum.
So what's really happening in much of managed health care, which is really disease care, is it's going now to more guesswork. Because they say, well, see, we can save some money by not doing a blood test or a urine test or an x-ray. So we're guessing that you must have arthritis. We're guessing that you must have a yeast infection.
Right, but here's the thing: is I believe that the doctors want to do a good job. They're being constrained. They're being constrained
by lay people who are trying to build a stock market.
Yeah, and it's not the doctor's fault.
No,
they're being constrained in other ways, and they want to.
Plus, the doctor's getting some kickback from. Bonus from the company by keeping his tests that he's ordering down, or he's getting kickback from drug companies.
Well, here's the thing. I don't know of any doctors like that, so I'm going to give them a benefit of a doubt because of the doctors that I've related to, that I really believe that they're honest to goodness, want to care for people. So I'm just going to go on from here with the organic acids, and organic acids analysis allows us to see what's going on with candida, the type of probiotics that you're taking the right probiotic. You want to see what's going on with yeast and fungus and bacteria, what you're dealing with, how to take care of it, as well as deal with the die-off factor. See, as these things die, they leave themselves inside of you, and you have to take care of the die-off factor of those events that are taking place from that also. So it also can dictate what kind of vitamins you want to take. If you're taking yeast, if you're trying to deal with yeast and you're taking a B vitamin, that many times B vitamins have been manufactured within yeasts. Okay? And so if you're taking a yeast like that to a vitamin B that's created from yeast, you're actually feeding the yeast from the dead yeast within the product.
Why is that chiropractor or nutritionist or massage therapist giving you a B-complex vitamin if you have a yeast infection? Why are you taking a yeast-based B-complex vitamin?
Exactly.
It doesn't make sense.
Exactly, as well as where the binders and so forth within the tablet are actually sugars that are feeding the yeast also.
Yeah, right. Or if you're diabetic or hypoglycemic, why are you taking it? Or if you have celiac disease, you have an allergy to yeast or to wheat products, is that vitamin wheat or gluten free?
So it's not just looking at what you need in vitamins, it's looking at the particular product that you're being supplemented with so that it helps you in all different ways. You don't want to have one step forward, two steps back in the treatment. Minerals, the particular minerals that you're going to need, coenzyme Q10, antioxidants are also looked at within this test. So we're not just looking at the problem, but looking at the problems that pervade from it, such as these bacteria. What they're doing is they're creating their own free radicals, but they don't deal with them themselves. So what do? They dump them off in their environment, which just happens to be you or I if we have those bacteria. Fatty acids, which helps us deal with what's going on in our sensitivity to these chemicals that are going on in the body. Okay, then food sensitivity testing. We're looking at IgG, fixed food sensitivities, and IgE4, which tests for the cyclic food allergies. When we looked at our diet when we were still going out and foraging for food, many times our diets had a spectrum of 200 foods. And now, in today's types of diet, we tend for what's more convenient for us, and we tend to just stick with about 25 foods, which means that our body is always trying to digest in the same metabolic pathway, and it gets worn out. So that can make us more sensitive to these foods, rather than a spreading of that. And what happens is IgG and IgE4 test for about 200 foods, and it allows us to see what we can eat and shows us how to stay away from the foods that we shouldn't be eating that are lending to our health problems that we're having right now. ChemScreen and CBC gives an internal biochemical picture and profile of what's happening in the blood to the different systems that are going on with us. Doctor, there's certain inherent dangers in all of this.
There is, and we've used that term already called Russian roulette. If I'm taking a food supplement for some kind of condition without a credible, accepted diagnostic test, then I'm like taking a gun and going, boop, oh, missed me that time, boop, boop, missed me that time. Well, sooner or later, you're going to get to a chamber where your health is going to fail. It really is. And I'm not being negative. I'm trying to save your life here now. So many times, these conditions are undiagnosed, misdiagnosed, or mistreated.
You took an oath, as I took an oath. It says, first, do no harm. And so if we're not diagnosing and playing Russian roulette, what is the outcome of Russian roulette?
It's like Thomas Edison said, the doctor of the future will give no medicines, but interest his patients in the care of the human frame and in diet. And that's exactly what, if you've got a chiropractor who's really doing a comprehensive job, it's true. And I want to bring up a point here that Dr. Jensen was very gracious about, that he didn't know any medical doctors, didn't mention chiropractors, but didn't know any medical doctors that weren't taking kickbacks. Well, you can open up your local newspaper, the New York Times, the Washington Post, or the Wall Street Journal on any given day and not see an article where doctors have been sent off to Hawaii, always in February or March, or to Europe for skiing for a seminar, and that they were getting X number of dollars from that company to endorse the use of certain surgical implants, certain types of surgery using certain types of equipment and things like that. And that's not an anti-statement, and they need to clean up that area. But again, hey, wherever there's greed, you can complain about the stock market people about being greedful. Hey, this greed, it knows no other, there's no limitations to it. The day doesn't go by, a month doesn't go by in our clinic that we don't receive telephone calls and mailings from vitamin manufacturers, nutrition companies, people selling vitamin products that say, Dr. Lala, if you attend our seminar, it'll be free. All the other people have to pay. That's a kickback. It's a kickback, and we don't play that game. Now, you can say, well, you're stupid, the other people are getting free. Well, I'd rather have some integrity in my life. I think that if Jesus Christ walked into your office and said, look, this is wrong with you, I think you'd give them the best possible care, and I don't think you'd take a kickback from a vitamin company or from a drug company or from a company that's selling surgical procedures. I don't think you would do that. And I think that's why the soul has been lost from the health industry. And it's aggravated by the pressure that are put on by the insurance companies too, because their job is to take care of the stockholders. Their job is to take care of the stockholders. It really is. So, long life and good health to you. Do something to find out about your health. Do it, would you please?